This is Jerry Hesch from the Hesch Institute in Aurora, Colorado, and this presentation is on treatment for either a posterior glide pubic bone or a lower pubic bone posterior rotation. When I have a patient that presents with that, I treat them once and once only, and I treat the whole pelvis. If there are other patterns present, I treat them as well. But it's usually a one-time correction, so I don't really teach these as a self-treatment. A pubic joint posterior glide fixation is a pattern I discovered by palpating the top of the pubic bone and the front, the two pubic tubercles, as is taught in the traditional model, but I also palpate the middle portion and I also palpate the lower portion, and when there is a posterior glide, then there will be a distinct step down when you slide across. And when you slide from left to right, there'll be a step up, and that is changeable. With a rotation, the axis is through the upper pube, so palpating the upper pubic bone, the front of it, will be symmetrical, and the middle of it will be symmetrical, but when you go down to the lower part of the pube, there will be a distinct asymmetry. Now, with both of those patterns, the left ischium is going to be more posterior, and that will stretch especially the sacrospinous ligament, but it will also stretch the sacrotuberous ligament, so there'll be increased tone in those ligaments compared to the other side. The right ischium will spring. You can load it and spring it and it'll bounce right back. On the left side, using the same amount of force and even doubling that, you get no motion. And the treatment is very simple. I developed this treatment and it's so simple. I use a piece of 2" by 4" by 8" foam, and it's a nice foam that gives a little bit and conforms to the shape of the body. You could roll up a towel firmly, a 2" diameter by 8" towel. And so I have the person lay on their back, and the foam is placed under the ischium, but not under the sacrum. And they simply lay there for 5 minutes. And that is how I treat either a lower pubic rotation. I've never seen it happen on the right side of the body, so I name it left lower pubic posterior rotation, or a pure posterior glide fixation of the pubic joint. And after doing this for 5 minutes, you will then be able to note symmetry of palpation, but also you'll notice that it's then able to get the slack and able to spring it. You will also notice reduction in pain, and you'll notice the sacrospinous and the sacrotuberous ligaments then have normal tone. I hope this is helpful.